Why genetic counselors are essential in managing osteogenesis imperfecta.
Yeah, I think very importantly, at least in our practice, we have a reference out to a genetic counselor because that's very important that the family understands what it is that they're dealing with. See, I mean, some of the questions may be very pertinent. This may be the first child. And then the pertinent question would be, what is the risk to my next child? We are planning to have another child. What is the risk to that child? It's a very pertinent question. I think it's far wiser to invite expert opinion from genetic counselors who have a lot more information at their disposal to guide parents with this extremely important decision making process. And obviously, at that point in time, the appropriate tests, the sort of detailed history taking, a sort of family tree evaluation, seeing what is it that is going on here. Does this child have a sort of de novo or spontaneous mutation, or is this something which is already historically present in their family, which is manifested now in this child? Uh, you know, those sort of questions will need to be evaluated and then answered. That is, I think, the first important step. The next is counseling with regards to the care of this child. And that is where it's important to again have a sort of multidisciplinary approach. There are pediatricians involved, there are orthopedic surgeons involved, and sometimes even we take the help of the family physicians because sometimes their pediatrician is very far away from their house and they'd rather just relate with the family physician who stays close by. So it's always a sort of multidisciplinary team effort to try and get better and better care for this child. Depending on the severity of involvement of the child, sometimes there is a need for hospital stays for the child during a fracture, surgical care. And when that happens repetitively, I'm sure the cost starts escalating. At that point in time, I think it's important to have some sort of social help available for the child. Does this particular child have osteogenesis imperfecta? That is a question being asked. I'm sure the genetic probe test that will give us the answer to that is probably around the corner. You see, the headache with these sort of tests is uh, you see, everything will have a pro and a con. So that definitely holds good with tests as well. So the question is, should it be used for screening uh, all offspring of this particular couple who had this child with osteogenesis imperfecta? I think that would be the next question. So you see, the use of that test will gradually broaden over a period of time